Allahumma salli ala Muhammad wa ali Muhammad. Assalamu alaikum, brothers and sisters. I pray that you are all doing well, inshallah. Welcome again to another edition of Let's Talk, and live from Ottawa, Canada, as well as live from London, UK. Joining me today, we have special guests as we explore the topic of let's talk in terms of the long-term impact of the pandemic on our mental, physical health, and as well as how to build resilience. So we're just going to wait for people, inshallah, to join us. And if you just give me a few seconds while I make sure that everywhere else we are live. So anybody in Facebook as well as in Instagram, just let us know that you can hear us clearly and make sure that tech-wise, we are all good. Assalamu alaikum, Dr. Mohammedabbas, as well as Dr. Sayyada from London, UK. So I see we're good, good on YouTube. Wa alaikum assalam. So we're good on YouTube. Sound is good. Just double check on Facebook if we are good there as well. MashaAllah, got a good crowd slowly coming in. Making sure that we can see each other properly. All right, I do believe we're good to go. Okay, so we're all good. We can all hear each other, inshallah?
Yes.
Yeah, okay, so I'm going to officially introduce our guest today. We have Dr. Sayyada Mawji, who is a family physician from London, UK. And we also have with us Dr. Mohammedabbas Khaki, who is also a family physician. And a cool fact about the brother is that he is the co-founder of the world-renowned Who is Hussain organization, mashallah. So it's an honor to meet you, because I'm also a member of Who's Hussain here in Ottawa, although I haven't been as active during the pandemic because I've been active everywhere else. But it's a beautiful organization that has reached, the name is a brand name that we know everywhere. Although we're not talking about Who's Hussain here today, but it's it's so cool for me to meet one of the co-founders, and I'm sure people who are joining us are also seeing who that is to meet. Alhamdulillah. So thank you both for joining us this evening for this topic that we're going to be exploring. So before we get into the topic a little bit in more details, I'd like you to both introduce yourselves in terms of your backgrounds, what you studied, and your experience as family physicians, please. Go ahead. So Dr. Mawji, tell us a little bit more about you can start.
Assalamu alaikum, everyone. Yeah, so I'm a family doctor based here in London, and sort of been working, I'll say sort of past the time on the front line sort of with the coronavirus crisis, with everything that's gone on. And I just feel like it's so important that we discuss sort of the mental health, the physical health aspect of, you know, how it's impacting the public, and what we can do to sort of, you know, tackle this in a way. And I've been watching sort of your previous sort of Instagram lives and all the sessions that you've been doing, and they've been incredible, Berak. So thank you for, you know, everything that you've been doing, and we're so happy to be a part of this today. Yeah, and have this conversation.
Alhamdulillah. Welcome. Thank you so much. So you've been practicing for how long now in London? How long have you been practicing now in London?
So I graduated from. Yes, so I graduated in 2013, so it's been about 7 years, and I've specialised in general practice, so that's sort of, I guess, the equivalent of sort of a family physician in Canada. So yeah, I've been doing that.
MashaAllah. So you've been very busy, I could imagine, the last while working, especially during the pandemic.
We sometimes get a little delay, so I think there might be...
That's okay.
Yeah,
that's fine. I see that too.
Yeah. Okay. Cool.
Yeah, huge amounts of changes in general practice here, and sort of we all just had to adapt to kind of, you know, all these changes that have cropped up, and yeah, it's had an impact on sort of how patients are accessing the service, and sort of, you know, what's been available, what hasn't, and again, this will kind of, we'll talk about a little bit more about how this, you know, might impact sort of patients sort of going ahead. So yeah, huge amounts of changes. It'd be interesting to know, I guess, from a Canadian perspective as well, what it's been like there.
Inshallah, we'll explore that. Now, how about yourself, Dr. Mohammedabbas? Tell us a little bit about your background, please.
Yeah, you can just call me Mohammedabbas, it's fine. So I'm a family physician in the UK, in London. That's it, really. It's sort of boring. I think one of the things that's really important has been how we as a global community have responded to the coronavirus situation. And I think it's been one of those things where it's demonstrated a lot about our character, and it's also allowed us as a community, a global community, to connect. Look at the way, for example, we're connecting today. But I think one of the things that we've seen in our practice has been the fact that whilst we are together and whilst we are a community and whilst we're always there for each other, it's also been a challenge in so many ways, from so many different perspectives, from the mental health perspective, from physical health perspective. And I think one of the key things is, how do we now mitigate that challenge going forward? How do we now look at building within ourselves some of the tools and cultivating those tools to be able to navigate the challenges ahead? And I think that's one of the things I've seen a lot in my practice. I'm sure that's something that you would have seen as well.
Well, I've seen a lot of challenges working in a university setting, and we've been working virtually now. So we're no longer working in the medical clinic on campus. We're working virtually from home, and we see a lot of the challenges in terms of how people are accessing supports. There's a lot of virtual medical appointments as well, not just the counseling, right? And so a lot of the counseling struggles have been amplified. So for people who have been dealing with, let's say, depression, anxiety, and isolation, these obviously have increased. The symptoms have increased, right? And it's interesting to see that some people have actually don't minded this. And I would say this is more the introverts who've actually enjoyed the isolation and not having to deal with the drama of people around them, or traffic jams. And so it's interesting to see how the short-term impacts have been in terms of not dealing with traffic, not having to deal with drama of people in their faces all the time, not the expectation of keeping distances. So people who are more on the introverted personality type side have been benefiting from this and liked it. The people who are extroverted, on the other hand, that has impacted them, I would say. And I've seen that with my clients who enjoy going out with their friends, who enjoy connecting and enjoy people and just enjoy being outside of the home. And that interaction, that loss of that interaction has been detrimental for them. It's been very challenging. How do we stay connected with people? How do we, because that's what makes them happy, so to speak. Interestingly enough, I was part of a webinar last week from a research about happiness. And the professor who headed these researches was actually from my own university, Carleton, where I work. And he was discussing certain aspects of what contributes to happiness or positive emotions. And what was interesting to see in his studies, he said that introverts who engage in extrovert activities minus the social aspect, so hiking, going out and doing things that are a little bit not necessarily risky but more adventurous per se, in the end they found that the introverts had more positive emotions. So they encourage people who are, let's say, isolated or not interacting with people, and they are feeling low in terms of how the pandemic is impacting you, engage in activities that extroverts would do, minus the sociability factor. That should increase the positive emotion.
Really,
so that was fascinating. In addition to that, and we're experiencing that with the short term, how we'll talk about long term in a few minutes, but short term, the impact of nature. There has been an increase of everybody talking about nature, nature.
Definitely.
And the research the doctor explored, and one of the studies he did, which was fascinating, was how does nature impact people? And so he specifically looked at a group of young students in elementary school and did a nature day camp, basically go out in nature activities all day on a field trip. And he compared the emotions, the impacts of such a trip to the same group of students that went to the National Aviation Museum here in Ottawa, in our city. And so what they found with it was still enjoyable, still educational. However, they found that these young students who engaged in nature, as opposed to the indoors of the museum, were more likely to be more generous, more kinder, and calmer. Subhanallah. So lots and lots of studies have been done on how nature impacts us. And so I have been dying to get out to nature, but I have been so busy with my full-time work, family, and these programs. Alhamdulillah, no complaints. I've been itching to get out into nature, and especially now. 2 weeks ago, we had snow here in Ottawa. We're finally having spring weather. So it's so important to see that impact for us to engage in nature, because it does have a calming effect. Subhanallah. So we've seen some of this here. These are some of the things that
I think
it's
given us the time to. I think it's given us the time to be able to do that as well, and to spend that time in nature, and just to appreciate it. I think, even before, when we were sort of going out and going for walks or whatever, it's the small things that we're all sort of now saying, actually, wait, I can actually just appreciate these things. And like you say, so many of my own friends have said it's been incredible just being able to spend that time in nature and the positive sort of effect it's had on them. And inshallah, this is something that we can also just continue going forward. So it's very interesting.
So what do you do when you live in London and there's no nature? There is.
Well, some of my friends are taking me to beautiful. No, I've seen some beautiful parks in London, and I'm taking walks in some areas that have that. And so for people who are stuck, you have to, I guess, go to areas where there's a little bit more green, or perhaps bring green into your home. So bringing plants into your home and taking care of them into your home, that also impacts you. So I have a question that somebody asked. It's not necessarily directly related to our topic, but I think it's important as a female hijabi doctor to answer this. So they're saying, as a female hijabi doctor, do you face any discrimination from others because of your hijab? What are your thoughts on that, Dr. Mawji? Being so formal.
Yeah, so I have to say from sort of, no worries, say that's absolutely fine. So from my personal experience, I've actually faced, no discrimination at all because of my hijab. I've actually found it sort of the opposite in a way, with sort of, the respect that you get. So I would say, no form of discrimination at all. I've actually probably had more comments about sort of my age and am I old enough to practice, rather than sort of comments on hijab or anything like that. So
that's interesting that that people will look at you that
I think it's
way,
an opportunity, isn't
your
it?
age. It is. It's a learning opportunity.
I think both of us get that, don't
most
we?
people don't believe in it.
Both of us get that.
Yeah, they don't believe it. They say like they say that, you must be a medical student. Do you mind if I see a proper doctor? Which I say, that's the absolute, yeah. I say, no problem, go see a proper doctor, they'll know better than. This is nice, it gives me a break for a moment,
Alhamdulillah, that's great. And mashallah, I'm so proud of you having representatives from our community, the Muslim community, that in fact you can get an education, and especially in terms now the pandemic, the contributions of our Muslim doctors, and amongst the first doctors that we heard that passed away during the pandemic in the UK were Muslim doctors, unfortunately. May Allah have mercy on their souls. And so I think there's a huge presence of Muslims contributing to helping in terms of building resilience, helping the community, helping people, and especially in the medical field. What are your thoughts, and just what's been your experience in terms of what's happening in the pandemic and how you are helping out on the front line?
Yeah, certainly. I think one of the things is that 70% of the NHS healthcare workers who've died on the front line are from a BAME population, so Black, Asian or minority ethnic. And of that, 1 in 3 identifies as Muslim, so a huge proportion. And I think one of the key things to remember is that one of our core values as Muslims is serving other people. It's one of the key things that we have ingrained within us. And I think whilst it's scary and it's challenging, and the fact that we know that, there's more research and people want to know why, and actually it's brought up a plethora of reasons, there's not just the fact that you're from that population, there's talks about social inequity, how people access the healthcare system, how we look after those deprived populations. There's a whole amount to look into. But if you look at it from yourself as a frontline healthcare worker, I think one of the things I think of it is as an incredible way for you to be able to marry up your faith and your practice. You know, in the Quran, we have this lovely verse which says, why do you say that which you do not do? Whereas actually in this, there's been an opportunity for us to actually actualize that, to say, look, you know, when you say, Allahumma Allahumma Allahumma, all these du'as that you recite, one of those lines when you say, oh Allah, oh, you know, help those who are sick. Well, maybe God says, I'm going to let you be my representative on earth to go and do that. And for us, I think, even though it's been scary, that has been a real honor and a real blessing to be able to do that at this time.
And to, I guess to be able to serve like that. You know, we've had a lot of, you know, oh my God, it's amazing the work that you're doing. But from our side, we do see it as, you know, a very blessed opportunity to be able to help, to serve, and to do the work that we've been doing.
But I also think that, like, I think that it's really important for us to recognize that it's not just one or two or the doctors who are keeping the world going. You know, one of the amazing things going on in London with a group called Al-Hadi, for example, has been the youth who are now off school, off university, have been contributing by collating all of the food and collecting all of that and giving everyone iftar, demonstrating so much. So I think, you know, wherever we are, we shouldn't feel disheartened to feel like, you know, I can't do anything, I can't contribute, or I can't actually, you know, I've got no use in this place. There's so many things and so many ways to contribute to keeping everyone's spirits high in this time.
And I think that's like one of the really beautiful things that we have seen during this,
and it is really important
is the whole community coming together in so many different ways.
Have you found that from yourself? Have you found that?
Mashallah, it's amazing to see.
I was going to say, sorry. Have you the time lapse? Have you
slight delay?
Have you found from your side that, you know, working and being there and speaking to people that they have got more respect for you, or found that they're happy with the work and the effort you're doing to keep it? Because obviously, you know, the mental side of this is so important, so important.
I have seen that from our clients, where they're really appreciative of the fact that we're still offering counseling supports, and even during the summer. And we don't know long-term how our classes are going to be. I mean, there's plans for the fall being virtual as well, because we shifted immediately from being face-to-face to everything going virtual within 5 days. And it was right before our exam period as well, which was really challenging. So the university did a phenomenal job of moving everything virtually. But then even after that, we continued to do the virtual all through the summer. So our summer classes right now, we have virtual classes, but then our services are all virtual as well, right? And then afterwards, the plan is potentially moving into the fall, like to stay like this. So the long term, here we see the long term impact on that, and it has frustrated a lot of people who, let's say, exchange students who can't come here now, our Canadian students who cannot leave, international students who've been stuck here. So we see the short to long term impact here, how it's going to be impacting students. People, Muslims I know who I've been speaking with, have been stuck here, not being back home for Ramadan and alone. So that has been really challenging for them. And we talk about, we're isolated and stuck and not going to the masjid. But we have still our communities here. These students, international students, don't have friends and family here. They are actually alone, right? We still have a community that we feel connected with through the virtual programs. We know each other. We still ask about each other. But we see here the longer term effects of how it's impacting people. They are feeling more isolated. There is a lot of depression as well. But there's also, you know, with these, now I think we're, you know, into the 2-month mark into this. I've lost count. What are we today?
We've literally lost track of kind of, you know, what day it is, or
people. Some of the speakers I've spoken to in different time zones, they're like, we don't know what day. All I know is day and night now. So that's been challenging as well, is to figure out where are we.
It's crazy.
So, but psychologically, we know.
I can't believe it's resilience.
May. I know. We're end of May coming up to it.
I'm still finishing my New Year's resolutions, which is a bit of an issue.
I think our New Year's resolutions have changed.
It is a new year.
On Layal al-Qadr, that's when we have restarted our resolutions and looked at it in a different way.
Absolutely.
But when we're looking at in terms of resilience, subhanAllah, how the human mind and body has the ability to adapt, right? And when we take a look at what resilience is, it's the capacity to recover quickly from difficulties, toughness, right? We develop a tough shell, so to speak. And so when we take a look at this, it takes around 2 to 3 months. Some people in between that time frame say this is when we get used to crisis, a difficult trauma, a difficult situation in our life, where we become more adaptable to it, where we have the resiliency to cope and deal with it. So we have been going through grief, so to speak, the last few months. We lost out on weddings, on events, commencement, graduation has been canceled. All sorts of these events have been changed for us. Ramadan, of course, and the gatherings at the masajid, but we pulled through. We have pulled through. We can see, mashallah, the gorgeous programs that have been out there with the different speakers and centers and programs that anytime you can lock into anywhere around the world. And the Layali al-Qadr programs, whether it's been the UK, I wanted to follow them, but it doesn't make sense. They're not live. I wanted to connect with people who were doing the programs at the same time here in our time zone. So it was amazing to see how part of the resilience and how we adapted quickly is that everybody moved their programs online. Everybody offered their masjids, not everybody, a lot of centers offered still cooking and delivering food to the communities, because a lot of families were coming to the centers that are families who come from low income and poverty, but they don't obviously say it. So the beautiful centers, what they've done is they've quickly changed that and did anonymous types of programming where families can still have access to the barakah and the iftars. You also see a lot of restaurants, and I give a shout out to my friends in Australia and here in Ottawa, Haj Hussain Faraj and his family. They took their restaurants next level before Ramadan, delivering food to people who needed it in their areas. And they have been going strong, mashallah. Look at the barakah and the blessings that they're using their wealth to help people this way. And especially now during Ramadan, the blessings there. So a lot of places have done things like that, where they've done the takeout for business still, but at the same time, they've also been helping. They've turned things around to help other people as well. So alhamdulillah wa shukr.
I think that's one of the key things that, I think one of the things that, exactly. And I think one of the things, so Sayyada and I have done, because we do a lot of medical relief work abroad, alhamdulillah, one of the things that we've completed recently is some further studies and a diploma in conflict and catastrophe medicine. So one of the things one of the studies we looked at was the study of how we improve that resilience within people. How do we now, when there's a disaster, when there's a catastrophe, when there's something unprecedented, how do we now build that resilience? How do we help those communities get back together? And this was based on studies from all the way back from the Spanish influenza all the way to now, in terms of all different catastrophes, the Ebola, war, natural disasters. And one of the absolute key things for building resilience is community. It's about extending your hand to everyone else and bringing them together, which is incredible, because the people who I see doing all the work in London, who are serving, who are working round the clock, so one of the brothers on here, Brother Amir Taki, who has been working round the clock, doing all sorts of programs this whole Ramadan. What you'll find is that when you call them or speak to them, they're not tired, they're not upset, they're not finding it very difficult, they're cheerful, they're happy. And I say to them, how come it's so much going on? And it's because of that community feel. And the studies show us that when you are able to reach out and say to someone, how are you feeling? I'm here for you. Why don't we meet? Why don't we connect? Why don't we talk about things? That is the most powerful method. Afterwards, obviously, there's other elements to which I'm sure we'll get into in terms of, if you've got other risk factors, if you've got medical problems from before, or if you have, you've seen trauma firsthand, and those things that can make it more difficult, but and may need psychological intervention or medication, that kind of thing later on. But actually, as a populace, I think it was 80 or 90% of people recovered well with good community support and us saying to each other, it's okay that you're finding it stressful, it's okay that you're finding it anxiety, feeling it's okay to feel normal. Not okay at this moment.
And the fact that, we're all in it together. The whole community is going through this together. So I think, I think just that whole, like you say, the way that the community has adapted, the way that sort of technology has been brought in to sort of, help with the situation, and then also not kind of leaving behind our elders and those who might not be kind of using, technology, or just, making sure that, the majalises are in kind of other languages, and Gujarati and Urdu and all, different languages, and making sure that the elderly are completely, included in this as well, through all of this. And I think that's really, really important as well, because they are already kind of, they're the ones who are usually at all the mosque programs, benefiting from kind of that community feel. So I completely agree that, coming together, and I think also kind of, there's a lot of research that's shown the positive impact of kind of what serving or kind of volunteering, the impact it has on ourselves as well.
Absolutely.
And again, that's
something
another,
I believe.
Resilience again,
that.
to bring in.
Volunteer has a huge impact on depression, and I encourage my clients all the time, those who are dealing with depression, volunteer your time, your skill set, your energy, because when you distract yourself with a healthy giving of your energy to others, subhanallah, it has an impact of helping you. And I recently reflected on this through the Quran from Surah Al-Layl, where the description of when you help and give to others, Allah makes it easier for you to do more of that. When you don't, it makes it harder for you to do good. When you do good, you naturally feel good, right? Like when you volunteer, help other people. And so in depression, when you volunteer and you see that, the more you do, Allah makes it easier for you to give and do more. Hence, you start feeling better. You're helping others. And it's this beautiful cycle that it keeps going.
Absolutely,
and it helps alleviate symptoms of depression.
Oh, absolutely. Yeah, it works on this incredible thing that I've been looking at recently, having discussions about, which is neuroplasticity. So neuroplasticity is our ability to change our brain. And it's something you'll know about, because in cognitive behavioral therapy, in NLP, and all these different practices, neuroplasticity is that methodology which allows us to reframe our thinking and create new connections. Now, one of the things that some of the research has shown is that when you help other people, not only are you releasing these hormones that make you happy, endorphins, dopamine, serotonin, these lovely happy hormones, but actually you're helping to reframe your brain's pathways, so that not only are you doing it for that small positive feeling, which some people get from a cigarette or eating something bad, you get that endorphin high, but then you'll need it again. Actually, in this sense, you're building new structures to give you that for a long-term basis. So it's really just a fantastic thing to do, and maybe something we can talk about for building resilience going forward.
Inshallah, this is one of my favorite areas too. It's when we do create those new neural pathways, right? And creating with these strengthened pathways, you're developing these new skills, right? So this is something we use in trauma therapy as well, right? Rather than focusing on the trauma, we look at breaking the emotion involved with the memory and looking at changing the memory feeling, the emotion of the memory to the memory. So it's that break. And then what are you doing is exactly what you said. You're creating the new neural pathways, which then create these new behaviors, right? And a different emotion to the negative memory, creating a positive emotion, or a different rather. So it's fascinating, subhanAllah, how our brains work, right? And how we have the ability to work through trauma this way. So we are collectively experiencing a global trauma. It has impacted us on so many levels. People have been impacted financially, emotionally, being cut off from other people. We know there's been an increase of domestic violence cases, including deaths, right? All because people cannot get out away from the person that they are with, who is the abuser. So we have experienced trauma at a global level in a very different way.
In so many different forms.
And like we said earlier, grief. Not only have people lost loved ones during this time and the illness, but also grief and loss doesn't necessarily mean death. It also means, like we said, loss of a job, loss of income stability. We're also looking at the loss of our interactions. Like we said, people are no longer able to do their weddings, right, on the same way as before. Big events have been canceled, conferences, commencement. So this type of loss has a huge impact on how people are dealing with this overall pandemic. So it's fascinating to see how, all right, so we are in the state of grief and loss right now. How are we going to work through it? Alhamdulillah, we've spoken about some positive things that we've seen, what the community has done and different services and what people are doing to help other people. Moving forward in terms of the long-term impact, how do you see things changing in terms of how we interact with people? There's almost this fear now of greeting people, whether it's holding them or hugging them or kissing them. I mean, this has become the norm for us now. And I
this
feel
is my new norm.
The knee like elbow kind of.
like we feel safer going outside now like this than we did without coverage. And when I go into a store and I see people covered, I'm uncovered, it's like, wow, it's gone the flip side now of the hijabis and the niqabis. But long term,
the covert Islamic movement by bringing coronavirus to the world.
So, a good theory there, right? There's been a lot of the theories going around, but what are your thoughts moving forward? The conspiracy theories, right? Well, so moving forward, what are your thoughts on that?
Yeah, I mean, say that. Do you see that? I just want to say, anyone who's watching this right now, all the people who've waved and said thank you and salam and hello, welcome to today. But I wanted to just demonstrate the importance of what's the word I'm looking for? I can't remember what I'm looking for. I think the key thing is, in this situation, is for us to look at the fact that it's very unpredictable. We have so much evolving going forward in terms of what's going to happen, in terms of testing, in terms of how we're going to reduce lockdown measures. And the interesting thing that's happening is that everywhere you go, everyone's playing it slightly differently. And that's partly to do with geographical issues, it's partly to do with political issues. What I would say is, from our
he
so
wanted,
basically, if you
wanted
got
attention,
to cover
your face with,
he wanted attention, and he wanted to join today. You know, pet therapy has a huge impact on a lonely.
I was just going to say, there you go. That's what we need.
Our neighbours have got a dog. I think what
they've literally got a dog in this whole.
But one thing to remember is a dog is not just for lockdown, or a cat, or whatever animal you decide to pick.
Yeah.
Very important.
So somebody made a comment here that I think we should. Okay, sorry, go ahead. Go ahead.
Oh, go on. No, I was going to say, if you do have a cat at home that you can cover your face with as you go outside, I think that's one of the most important health benefits to having a pet.
It's to cover your face with a cat. Do you know how much fur this guy has? I cannot go get him shaved now. We're eating his hair. See, we're eating his hair, and doesn't help for allergies.
Different type
in any case, somebody mentioned, I think we should also appreciate that our lifestyle from before lockdown wasn't exactly the most
breaking up a little bit.
That's right.
What are your thoughts on that?
Yes, I saw that comment actually. I thought that was quite a good, quite an insightful comment. Sayyada, do you want to speak?
Yeah, go for
it. I think that's a really nuanced point, because I think mental health has been a topic for a long time that has never really been done properly. It's been something that we have always, especially as our community, either the BAME community globally or the Muslim community, has always had stigmas associated with it. And actually, one of the key things I want to talk about today was addressing the stigma and saying that actually we need to talk about mental health. We need to address the fact that whilst physical health is so important, mental health is also key. And it's just because an illness is not visible, it doesn't mean that it's not having a huge impact on us. So that's the first thing I think, is recognizing it. Absolutely. The second thing I'd say is that and normalizing, saying it's okay to have these discussions. It's okay to say I'm not feeling okay. It doesn't mean that you're a bad Muslim or have bad faith, or that you have done something, or a jinn has possessed you, or any of the multitude of reasons. It's okay sometimes to just feel not great. Your faith isn't a problem. It doesn't mean that God doesn't love you. It just means you're not feeling great that day. Let's talk about And I think that's one thing. The second
and
thing
you're
I would
hearing
say
this
is
from medical doctors, and this is coming
yes.
from medical doctors.
Yes, yeah. And there's a few YouTube talks we've talked about it as well, saying this is so important. And I think the thing that I would say is, the second thing is, of course, whilst mental health was an issue beforehand, it's not going to change in terms of going away, but now there's new challenges and there's new advantages as well. So as we've talked about today, you know, the ability to actually contribute and help and serve other people is a massive opportunity now. I think also there's an opportunity to do things that people hadn't thought about. You know, lockdown has given people a chance to pursue some of their hopes and dreams they hadn't considered or whatever. But I also think what's really important is for us to remember that it's still a very uncertain time. And actually, when you look at anxiety and depression,
yes,
one of the key reasons that people feel anxious or depressed is because of uncertainty. So let's not beat ourselves up. Let's not put over pressure on ourselves that I'm in lockdown, I must go out and do these things, I must now become really physically fit, I must now readdress all of my relationships, I must now...
putting sort of, all these kind of targets and goals and all these sorts of things that we kind of have to hit now that, you know, we've suddenly got all this time. Yeah. But what we were saying sort of a while back was that it's difficult to get these things done just, you know, even when you have a plan and you know what's happening and there haven't been any changes in your kind of, you know, surroundings or situation. Whereas now there's been like, there's changes every day. There's so much uncertainty that we have to just kind of say to ourselves, yeah, it's okay. We don't need to be kind of, you know, be building businesses. I know that, you know, people are doing those things and it is happening, and but it's fine if you're not, you know, even if you are just kind of taking it on a day-by-day basis, that's absolutely fine. And just going back to that point about what I think the sister was saying with you know, in terms of patients who already had sort of pre-existing mental health problems. So there's a lot of research which shows that, so a study recently showed that 80% of those who already had a serious sort of existing mental health problem have found that their mental health problems have just got worse in this particular sort of situation. And I think it's, you know, comes back down to, again, you know, all those exacerbating factors that we've mentioned, which sort of, you know, just build on top of each other, as well as maybe not easily getting the usual access or kind of the routine check-ins that you might do with your own doctor, or the, you know, therapy sessions. Obviously, you know, it is now, there is a lot that's been done in terms of video consultations, but it's not the same as having that kind of face-to-face contact. So I think, you know, we do have to recognise that and make sure that these patients are getting the right help that they need at this time. Absolutely.
Somebody's put a comment
from your perspective, I mean, how have you
and
found...
my cat leaves with hair everywhere. It just gets all over the place and itchy and allergic. Yeah. So somebody mentioned here, people are taking it easy down here. I'm just reading a comment somebody mentioned with questions. So people are taking it easy down here in Birmingham. Notice many who are getting negligent and careless and just going out saying everything is okay, we can meet and go out. So this person has noticed that that's happening there a lot, and it's causing a lot of fear and uncertainty. That's what the sister is saying here, you know? Yeah. Another comment, people are saying hello to the cat.
In terms of them coming out.
Social distancing.
Not social distancing, yeah.
Yeah. So, so let me just see here some other comments that people are...
I think, I mean, obviously, you know, whilst you look at the comments, I'd say that the most important thing is wherever you are in the world, it's very important to stick by your guidelines. You know, this is today, obviously, we're talking about mental health as a key and how we can build resilience and how we can future-proof ourselves. But and we tried to have some humor and things to break it up and keep everyone enjoying the show, but and guest appearances from the cat. But what I would say is that it's absolutely essential that we stay on point with the messaging from our governments and wherever we are. And I know that, for example, if you're in the USA or Canada, it may vary depending on which state you are. And it's so important to stay by the guidelines because, one, for your safety, two, for the safety of everybody else, and three, because we're in Ramadan, a time when we say, let's obey our Lord. And our Lord says, stay by the guidelines and listen to the rules of the place that you live in. You don't bring in your own rules, you listen to that rules, exactly where you live. So we have to respect the beautiful countries and places we live, and how amazing the opportunities we have here to live and to contribute. And we must do our best to respect everyone who's around us. So if you are seeing people at Eid or in the next few days,
I think over, especially as we come into kind of, in the weekend and around Eid, seeing sort of lots of messages kind of flying around as well, that there's groups that are planning to meet and all these sorts of things. So I just think we have to be really, really sort of vigilant and yeah. And it's so important that we try to not have that sort of second wave.
Absolutely.
So it's so important to keep that in mind, brothers and sisters, during Eid celebrations. It's just because we're still in it. We're still flattening the curve, so to speak. We don't want it to go back up again. So please
Absolutely.
abide by the guidelines of what we're hearing. So somebody's also asked, perhaps you can give us some tips on that could help with coping with depression, anxiety, moving forward as well, because it looks like this is going to be a bit of a longer term thing. People are saying, oh, we'll be done by June, July. No, it doesn't look like that so far, right? So what are some tips that you would have on that? And have you dealt with clients before with depression and anxiety?
Oh yeah, one of the key parts of our job as family physicians is mental health. In fact, I think 1 in 2 consultations we see now is mental health, because of the rise and the importance of doing that. So, I mean, look, I'm happy to add some things. I would welcome your points as well if you want to. Do you want to start, or would you like me to add some? Do you want me to go with it?
You go for it. Go for it. People have heard a lot from me. I want to hear from you now.
I would say, look, I have loads of things I want to say about this because I think it's so important. So I'm going to try and be kind of really quick with it in terms of like points, and then we can. So first of all, there's something in medicine called a biopsychosocial approach, which is biological, psychological, and social approach. So what that means is we look at you as when we look at mental health, for example, we should look at it on those 3 areas. So socially, there's so many things that we want to look at. How do we interact with our community? How do we interact with our friends and family? Now, I can see someone's written that we can support each other through FaceTime or Zoom. We need to develop a coping strategy. So definitely let's not forget that physical distancing doesn't mean social distancing. We don't have to.
I don't like using social distancing. I don't like that word at all. Exactly. I've been changing the language to physical because we still have to keep the social while keeping the physical.
Yeah, it's so important to stay connected.
Exactly. Yeah. So that's one that's really, really important. And I think even when you mentioned that, introverts and extroverts have found this difficult, I think it's really important that both recognize that there are still tools that apply to both. And introverts may not have a huge circle of friends, but they have very close friends and they're very close to their family, perhaps. There's certain members of people who they are very close to. Let's remember that we need to not suddenly break ties with everyone or forget that this was what we were like before. Let's not continue. So I think one of them is the social element's really important, stay in touch. In terms of some of the tips I've been giving about how we can manage at home, one of the things that I've been talking about is looking at how we look at the media that we take in. There's a lovely concept, which is, would you let anybody come into your house and, just walk around, open your door and say, anyone can come in? And you wouldn't. And it's similar to your mind. Would you let anybody come into your mind and just do what they want to? No. And that means that we have to be very careful with the kind of messages, the inputs, and what we follow. So the social media accounts you follow, if you're finding that some of them are causing you to feel upset or anxious or maybe even jealous or worried about your own position, those are not accounts to follow. It's important for you to then mute them for a while or unfollow them. Following and unfollowing in this whole concept of followers is a man-made concept. Actually, it's our actions that count, and it's really important to remember that, just as an aside of my social media. But so what I would say is, with social media,
even the news that we
so one thing, limit who you follow and the kind of stuff you follow, and 2, limit how much time you spend on it, because it's easy for us to jump on it, wake up, go on Instagram.
Well, it's the new addiction. It's a new addiction,
yeah.
and we were exploring this topic a few days ago with Nasimco, which is the equivalent of Kismek in North America, the UK, where we were exploring addictions, and the new addiction now is these devices. Absolutely. And how it impacts the brain. And it actually, studies have shown that the addiction we have to our devices release the same kind of hormones and chemical changes and brain changes as they do with alcohol, pornography, gambling, and drugs. So the more that we need to use these devices, it's never enough. So we need a higher hit, so to speak. And it's so dangerous because now we're told be virtual, but now because we can't do anything else. So we also have to be very careful. How are we using these electronic devices? For what are we using them? And also how to balance it with everything else. Sure, we can use them for education, for entertainment, to connect with our friends, but it doesn't mean 24/7 that that's what we need to be doing. We need to redirect our energies in different ways. Yes, we are dealing with a global trauma, but we have to deal with it in a healthy way to get through it as well.
Absolutely.
That's the key. Yeah. And actually, this is a chance for us to build those healthier behaviors. You know, one thing I've done for the last week, for example, it's the night, so it's been a time for us to connect. So I've just taken my phone, put it somewhere. I don't even know what's happening with it, and I've not really been on social media. I've not been on things, and I felt absolutely fantastic. I think it's really great because, you know, we have this odd situation where, and I only realized this after some introspection, which was the phone almost controls you. You wake up and you grab it, and then it rings and you run to it, and
it
beeps and you. Your Pavlov's dog. Yeah, exactly. Pavlov's dog.
And I think as you've sort of mentioned as well, this sort of the physical impact of kind of, you know, constantly being kind of, you know, on a screen, or in terms of kind of the effect it also has on our sleep, and sort of just moving on to kind of the physical aspects and the tips for sort of, you know, building resilience. If, you know, even if dealing with sort of anxiety, depression, sleep is so important, and getting that sort of good quality sleep. And again, it's, you know, when we do have our phones with us and we're looking at it at sort of the last thing before bedtime, we're looking at the screen, it does have a negative impact and sort of on the quality of our sleep. So I say sleep is
the key. You all know this better than us, but one thing,
becomes a vicious cycle when you don't get that.
One of the things that we look for in severity for patients of any issue, pain or mental health or anything, is this affecting your sleep? And if they say that, it's like a red flag, because sleep is just so essential. You know, if you are not sleeping well, you're not feeling rested, your mind is feeling more anxious, you're not getting that time for your brain to switch off, for your body to reset itself. So I think sleep is really important in these next sort of, you know, few months, few weeks as we go forward. One of the key things to look at is sleep, for sure.
And I think someone's just said getting good quality sleep is really difficult in Ramadan. Yeah, completely
it's challenging.
Agree. So
it can be.
I think our routine and structure has changed anyway because of everything that's gone on. And then into that, we've got sort of Shahr Ramadan, which again has sort of changed our whole kind of pattern and sort of, you know, sleeping behavior. And
another change we've had to deal with.
But I'd say, you know, try and another change we've had to deal with. So I think, you know, it's important to try and have some sort of structure to your day, which I know can be difficult, especially when many of us are working from home. You know, there's children at home. It's not, you know, that structural routine that, you know, is missing. There's no schools. So I think trying to have that, or trying to build in some sort of routine, you know, trying to kind of make sure that you sleep, so sleep hygiene is really, really important. And it might be something interesting for sort of the viewers or listeners to sort of look into that a little bit more, and tips that they can take from that in terms of trying to get good quality sleep.
And there is some really good information online about this, because I think sometimes, you know, we've mentioned 3 or 4 things already, and there's already like I've got 6 or 7 other things I'm thinking of. So what I would say is there's a lovely website called patient.co.uk, and I tell everyone to go to it. And because it's a website anyone can go to, and it has information about every single condition and every sort of thing. And one of the key things it talks about is sleep hygiene and how you can actually assess your sleep hygiene. Am I looking at my phone before I go to bed? Am I how much blue light am I getting in? How much, all the kind of elements of it. And it helps to address those factors.
Absolutely. And this is something I talk about all the time when people ask, how do I take care of my mental health? Eating well, sleeping well, exercise. And the sleep is crucial. Yeah. And when we talk about sleep, what happens is there's a regeneration of the cells. The memory is stored. And as students, this is vital, right, for our studies.
Yeah.
So, and it helps you feel more refreshed, and you're able to handle the stressors of the next day. Now in Ramadan, of course, that's another change we've had to deal with. First the pandemic, then Ramadan, and that there was already off sleep cycles before, and now even more so.
Absolutely,
and we're almost near the end, but I'm sure a lot of you have figured out what works for you, and also talking to your work about a different work schedule. I've been doing that for years now. I always make sure that my work schedule is a certain way during Ramadan. As soon as I know when the first day of Ramadan is, I go and take off the 3 mornings for Layal al-Qadr the next day, because I want to make sure that I have my proper ibadah without worrying about my work. So there are things that we can do preventatively to help in our sleep. There's also sleeping aid, right? There are things that you can do before you go to sleep, creating a healthy sleep routine, which includes not watching drama killing murder shows, because that just spikes up your anxiety and just your body response to that. So you want to watch things that are perhaps calming and relaxing. I remember I was watching the show that I was following. It's the Turkish show of Ertugrul. I'm sure a lot of people love that. Problem with that show, I found over time, and I stopped watching it. I stopped because it was so violent, and before going to bed, I noticed my heart was racing all the time. That wasn't a good way to go to sleep. I would have to watch some kind of relaxing show after that. So being mindful of what you're watching before you go to sleep is important. Your sleep routine also could include having a nice relaxing hot shower, because the cooling down of your body is actually what makes you sleepy. Drinking things that are not with caffeine before bed. And I know a lot of people sometimes are immune to that. And I know in my community, Arabs, they love their qahwa, their coffee, their ahwe, and their chai, which they drink at night even with caffeine. I'm like, how does that not affect
you? 6 sugars in
it. 6 sugars, right? It's more like sugar with a bit of chai, right? So,
it's like, tequila.
So you got to be conscious again of what you're putting in your body that way. How it impacts your sleep. And like we were saying, perhaps reading du'as or Quran or something calming, listening to relaxation sounds before going to sleep. So
things
people
like
always ask,
meditation.
how do you get a good night's sleep? Yeah, so these are small things that we can do to help with getting a proper sleep. During Ramadan, it, of course, a flexibility with your schedule. And somebody mentioned mindfulness meditation. These are great. Deep breathing strategies, because sometimes our minds are just constantly racing. So it's really important to be able to look at different things, and everybody's different. These are some strategies that are well tested through my clients, myself, and through the professionals as well. What was the website?
I think so it was, the website was patient.co.uk.
Perfect.
The other thing I think, just adding on to that is things like journaling as well, sort of before bedtime. Having kind of a gratitude journal, exactly. Just even if it's really simple, listing kind of 3 things that you were grateful for in the day, whatever it is. I think that can be a really nice way to kind of have some sort of nice relaxing kind of way before you go to bed, and also in a positive way as well, have a bit of a positive impact by doing that. So that's something else.
I think that
what we've noticed also sorry, I was just saying quickly in terms of studies on happiness. No, I want to get back to that, but just quickly, in addition to what the sister was saying, is that I lost my train of thought. Oh yes, gratitude. So some studies have shown that if people keep up doing a 20-minute walk, all right, 20 minutes of journaling, but including gratitude reflections, these increase positive emotions. So imagine if you do that before bed, you are leaving the realm of this physical world with these positive things and emotions. How does that impact your sleep? So brother, you were saying from the Holy Quran?
No, so I would say is with exercise, it's really, really important, as you mentioned, in terms of all those things. In terms of the physical benefits are the endorphins, dopamines, all those things, the happy hormones. the benefits on our, let's go like scientific, on the endothelial, on the vascular system. It does loads of really good things in terms of building circulation and connections. And actually that allows the flow of blood and oxygen to different areas, especially to the brain. And all of that improves our feeling of well-being. But
yes.
If it's too close to sleep, it can also make you feel energized, a little bit like the adrenaline that we release from watching Ertugrul and various other things. Well, I definitely think the gratitude is a really interesting thing, because it ties in with that Quranic ayah, which says that surely in the remembrance of God, hearts feel peace,
serenity, and peace.
Serenity. And I think this is all to do with perspective, because you know, there's a lovely saying of the Prophet, peace be upon him and his family, when he says that that if you wake up in your house and you have clothes and you have covering, shelter, and you have food to eat, you have more than you need. You're blessed beyond need. I'm paraphrasing. And the importance of that is the perspective it gives us. And I think that's what gratitude does, isn't it? When you sit and go, I'm so thankful that I have an internet which allows me to connect to people. I'm so grateful that I don't have to wonder where my next meal is coming from. I'm so grateful that I have functioning limbs. Or I'm so grateful that I have an opportunity to speak to people around the world who are able to give us input, like Berak is able to. So, and then I think if you look at that, suddenly you think, thank God. Because I'm blessed from God. This is all from God. And then you think, you remember God. And that's it. I think that is why you get that feeling of serenity, because you suddenly go, wow, I've got so much. I'm beyond. I've got everything I need.
Yes.
And I think
that's beautiful.
And I think that one thing that I would say that is really important is, because I struggle with this a little bit, because I don't know, but I think journaling is really, really important. But I think sometimes we put pressure on ourselves. I must journal.
I think someone's asking about tips.
Like someone's asking about that.
I think, I mean, I don't know what kind of your thoughts are, but from our side, I think because you want to build a sort of a habit that you can continue. I think the easier you make it for yourself, the sort of the more you're more likely you are to stick to it. So I think just really simple ways in terms of end of the day before you go to bed. It doesn't have to be in a particular journal. Just get a little notebook and write down sort of 3 things that you're thankful for, or 3 sort of things that have happened in the day that brought you
even in your head, even in your head,
literally even in your head. So I think just make it really simple. There's no kind of set way. But...
Do you know what I think to do? I think like it's really nice to do that at the end of the day. And in fact, Imam al-Askari Islam mentions that if you're not from us, you're not going to be a true follower unless you reflect on yourself and reflect on every day. And many hadith about how one day for the moment shouldn't be the same as the next day. We should be improving. But I would suggest that a really good way to do it is to have that gratitude exercise or concept in the morning. In the morning, because if we do it in the morning, we have 2 minutes.
Okay.
Yeah.
Until we're gonna,
because you can start off your day positively. So do you want to continue more after?
Exactly, yeah.
We can, okay, so we'll go back in after. So just, go ahead.
Are we going to loop? Should we disconnect and reconnect?
Oh, no, it will be cut off. We got 1.5 minutes. Let's keep going. And then when it finishes, I'll get you back in there.
So I think the key thing is the gratitude exercise in the morning. Because I think when you start your morning that way, it sets you off off the right way. And in the evening you can reflect. In the evening you can note down what you did, how your day was, and how you mitigated those challenges. But if you start in the morning, it's incredible, because suddenly nothing can touch you. You feel like
you've got all of those. You're sort of woken up with that positive vibe. And like you're saying, it can literally be simple as just having a quick think, in your own mind about these things. So definitely think that's something that everyone can try.
It's very powerful, subhanAllah. The impact of positive thought is incredibly powerful, and we have this from our own traditions, where the Prophet talks about tafa'alu bil khair tajidu, right? So propagating goodness, positivity, you will find it. And that in itself is such a powerful
beautiful.
statement
Wow.
to have. If you propagate that positivity out there, it will come back to you. So imagine if you practice that daily in the morning, daily in the evening. So we're going to be kicked out. So for those of you, join us back in on Instagram in about 10 seconds, and then we'll continue thoughts. Right at the end, things get lit. That's how it goes.
Yeah.
All right.
What's that one there?
I don't know. It's Tez.
Okay, so we're just about to go in live. Just give me a moment. Sorry, just one moment. All right.
Yeah.
Sorry, just a second. Bear with us, everybody. Just a second. So just get your questions ready for the next part. While I just get this in here. Okay, one second.
Yeah.
So.
My mum's cousin.
Is it going on?
Okay, one second. All right, so I'm gonna go live. All right. All right, we're live. So come on in, join us.
This one.
So just waiting for you guys. You see it?
Just look at this.
There we go. So we're back on live. SubhanAllah, right as we were ending off that 1 hour mark, that's when everybody was asking questions. You good? Okay, there we go.
Yeah, exactly. Yeah.
Well.
Yeah.
There
Okay,
we
we're
go.
back.
Assalamu alaikum. Welcome back. So I was just saying, SubhanAllah, right at the end when we were finishing up these questions, or just finishing up that 1 hour mark, that's when everybody started asking all these great comments. I had these questions and comments. So I don't recall some of them, but they were all related around the ideas of gratitude, of positivity, of how when we put out that positivity, how we found it, right? So let's wrap up the last bit of this in terms of the discussion of long-term, okay?
Mm-hmm.
Long-term, how do we deal with the pandemic long-term? And I think we've touched upon it now with positivity as well as gratitude. But what are some other thoughts as medical doctors that you have in mind, thoughts that you have in mind, and advice for our viewers?
So I think the other elements are the other couple of, I think 1 or 2 more points I think would be useful for us to share before we sort of close the seminar for today, because I think that's quite a lot of good information, and we can maybe catch up in a couple of weeks and see if people have been able to do it.
Yeah, that's a good idea.
I think one of the things that's been very powerful has been, as Sayyada mentioned, the power of habit. And in this time when we have, I think after Ramadan, Shahr Ramadan, we should give ourselves an opportunity to try to cultivate good habits and a schedule, even though we're not necessarily at work or in a position where we are able to actually have a schedule. And I think that would be really, really powerful, because that has been shown to, when you have structure, when you know where you are, you're able to control what's within your control. And I think that's the key. In this situation, we're so
There's
uncertain.
so many things that we can't control.
Yeah.
But focusing on the bits that we do have control over. So, we do have control over not kind of having large gatherings or whatever it is, and helping to flatten the curve and all these things that we've been talking about, or on our sleep, on whether we're exercising, what we're eating. So focusing on these things that are within our control. And
a practical way to do that is to have a schedule, have a routine, and that will give you that sense of control, that even though if I can't understand the events outside, I'm in control of my social media. I'm in control of how much TV I watch. I've got a plan for my exercise. I've got a plan for my gratitude. I've got a plan for my sleep. And I'm controlling what I'm seeing and taking in and the inputs. And I think even though they all might sound like small changes, that's what will cause that amazing ripple effect, and God willing, give us that sense of calmness, serenity, peace that we're all striving for.
Exactly. I find that when we do have that routine, this is what we have control over. And that's one of the big things we talk about with friends, family, clients, is when we look at basic stress management, again, eating, sleeping, exercise, routine. My cat did a number on me here. The hair is just tickling and I'm going to start sneezing. Ooh, hair is still here. So it's very important to have some kind of routine and look at what we do have control over rather than what we don't have control over, right? So we don't have control over what's happening outside, but we have control over how we choose to respond to these things. And somebody's asking the questions. I always wanted to know, how do I have the conviction towards my daily routine? How would we work around that?
I think one of the key things with the conviction is there's different things, and it kind of comes into knowing yourself a little bit. What are your drivers and what makes you do the things you do? And I think when you are able to then recognize that, you're able to put into place methods that allow you now to hold on to that. So, for example, say that you're somebody who likes working under pressure. If you like working under pressure, set yourself very small, tight deadlines. Make it very tight that you have to meet those things. If you're somebody who likes the feeling of routine, draw up that routine, draw it on your place and commit to it. One thing I would say that is really important is, even though we've talked about a lot of things and a lot of really good methods, don't feel like you need to do them all at once. This is one of the biggest mistakes we make from Ramadan, from life. It's that, I'm going to start the Layla, it's going to be Jafar al-Tayyar, it's going to be this many safaras a day, it's going to be everything. And actually,
start with one thing. We always say, try and make these things kind of doable for you, and make them kind of, realistic to achieve. And even if you have a routine or a schedule or a timetable, give yourself some leeway, make it flexible, give yourself breaks within that. It doesn't have to be so formulaic, and so, allow yourself to kind of, have days where it's fine if you didn't get certain things done, but you can times to catch
self-care.
up. So make it self-care, make it work for you. Exactly.
People are laughing at that comment, because it's true. We can be very overwhelmed with everything that we set out to do because we're so ambitious, right? And you could be on that high, but then the next day you could be at that low energy rate. It's really hard to get that done. And you know what? It's okay. You're allowed to take time off. You're allowed to take care of yourself. Who is going to take care of you if not you? Nobody else is going to do that for you. So you really have to know your limits, know your strengths, know when to push yourself and know when to give yourself a break, right? So these are some amazing tips. Let's quickly just run through them. So we talked about spirituality. We also talked about practical strategies when it comes to eating, sleeping, exercise, right? Go and do things in small steps, short-term goals that are doable, that is not very challenging. So somebody asking, can you do a session on how to deal with loved ones who have mental health illnesses? Would that be something you'd be interested in doing?
Yes, and whilst in the interim, I've done a talk about this on YouTube with Inspirational Minds, which is a community group, talking about how to access.
I work with them as well.
I know you know all about them. They're an amazing organization, and I think we were meant to have a session when you were in London, but we just weren't able to meet. But I think, I think we should. I think we should do that. It'd be really powerful.
All right, so we'll keep that in mind there. Let me take a quick screenshot. Hope I don't turn off my phone. There we go. So we got the question in there. So can you do a session on how to deal with a loved one who has mental? That's a really good topic. So inshallah, we'll arrange for that, to do that in the next few weeks, inshallah. Thank you so much for the feedback, everybody. Really appreciate it.
Thank you.
And inshallah, what we've presented today, again, always when I talk about mental health and with our guests, it's just scratching the surface. The more we discuss it, the more in depth and just deeper into the topic we can get into. And it's amazing. I'm so happy to see so many professionals from our community. Props up to my sister, you know, the hijabi sister in the profession, which is also an inspiration for our young viewers to see that, you know what, you can do this. Even if you wear hijab, with your hijab, you can succeed professionally when you have the supportive spouse, like brother Mohammedabbas here, who's supporting his wife to be a doctor as well. And they're working together, mashallah. So it's amazing. It's amazing that we have the support and you can continue doing that. So again, thank you so much, doctors, for joining us and sharing your ideas, your wisdom, and your experience. And I just want to note here that our Facebook viewers, thank you to them as well as YouTube. And somebody gave a really beautiful dua here. And I think it's really fitting to finish off this dua, especially for the people who are joining us late. And it's the dua to read before you go to sleep that will help you. Okay. So I'll read it and then we'll close up after that. And it says, and it's in Arabic, so I don't have English translation, and forgive me if my Arabic is a little bit broken here, you know?
It's okay.
Look at the beautiful comments that are coming through. Bless you all. Thank you so much for all these comments. Do you see them? They're all... Oh, brother, they're asking about the talk. Where can they find that talk?
I'm just watching this now. I'm actually reading.
Yeah. Thank you, brother Hussain.
So
they're asking about...
inspirational.
What's your YouTube? Inspirational
If
Minds?
he DMs me, then I'll send it to him.
Sure.
It just tend to DM me and or hit a sister and I'll
or
send
you
it
can put it on stories or something.
Sure. But just what's the name for the viewers who are not going to DM? Inspirational Minds?
I think it's under Inspirational Minds.
Okay. And I see Farzana's also joined us as well, who is one of the founders of Inspirational Minds as well. Shout out to you, sister, praying for you always. She's the boss, bless her. So I just wanted to give a shout out also to Bronze Digitals who made the beautiful posters, and all the posters. They came during the pandemic and offered to do the posters for these events. Poster. So a shout out to our brothers and sisters at Bronze Digitals, for anybody who are looking for people from the community to do web design, posters, flyers. I highly recommend, and so do the doctors, Bronze Digital. They've been doing amazing designing during the pandemic and offering their services. Amazing. So inshallah, give back to them by connecting with them if you are in need of services. So inshallah, let's finish up with this beautiful dua. Forgive my Arabic if it's broken here, even though I am Arab. So it says, Bismillah ar-Rahman ar-Rahim. Allahumma gharat al-nujum wa hadat al-ayun wa anta hayyun qayyum wa la ta'khudhuka sinatan wa la nawm. Ehdi'i layli wa anim aini. So beautiful. I'm going to give a very loose translation, which says Allahumma gharat an-nujum, something about the stars and calming of the eyes, and you are the all-living, everlasting. Please calm my sleep, calm my night, and sleep my eyes, or make my eyes sleep.
Oh wow,
so beautiful.
Lovely.
Thank you so much.
Oh, that's nice way to
It is really nice.
Lovely prayer.
Lovely. Thank you so much, Sister Rana, for sharing that with us. And those who are asking where that is, that's on the Muslim Counsellor Facebook page. You'll find that dua written there. I don't have a source as to where it's from, other than a lovely participant shared that. As she says, this is something to read before you go to sleep. So I think that's such a fitting way of ending this. It was lovely speaking with you both. Thank you so much. And we already have a next topic to discuss, huh? Inshallah.
Inshallah. That would be great. So, and thank you, Berak. Really appreciate it. Thank you so much for doing these sessions.
Yeah, fantastic.
Thank you so much. Bless you. Thank you. Inshallah. May Allah accept it from all of us, inshallah. And please keep everybody in your du'as. And of course, prayers to all of those who have been losing family members, because we've heard, whether it's in England, whether it's here in North America, all around the world, for everybody who has been struggling with loss. We are here for you in du'as. For those of you who are struggling with mental health issues, as always, we say connect with us and we will connect you with the appropriate resources, inshallah. So please do reach out. And every time after the show, there's lots of people who do reach out, and we encourage you to keep doing that, so we connect you with the appropriate resources wherever you may be. Thank you so much, brother.
Yeah, I'll just add to that very quickly, is that it's so important to do that. You know, we are here still to support you through, you know, any physical illness, any mental illnesses. So definitely reach out and get the right support that you need. Through it, you know, there are, like we said, these video consultations and things that are still happening. So please don't feel like you're alone at all, you know, whilst going through this.
Absolutely. And that's part of normalizing mental health, right? Is we have these open discussions about mental health from every angle, inshallah. So stay tuned for next programmings, inshallah. And I highly recommend the series by Hajj Hussain Rajab Ali.
Inshallah. Thank you.
His nightly programs of in Light TV, these are fascinating because he brings in experts from all over the world of different backgrounds, looking at Quranic commentary and applying it to our daily life. So that's one of the really good ones that I find that people follow. Yeah, they're at 10 o'clock Eastern time. They have the dua ahead of time. But it's pretty late for you guys, around 3 a.m. But inshallah.
You can catch it on YouTube.
All right, take care, everybody. Assalamu alaikum. Please remember, everybody,
in your du'as,
inshallah. Assalamu alaikum.
Please keep us in your du'as too.
Thank you.
Take care. Walaikum salam.
Thank you so much.
Hafiz.
Inshallah. Assalamu alaikum. We are off. We're okay. We're off social media now. We're good. All right, let's turn the sound back on.
Yeah, we've just turned ours back on. Is this still live or?
No, we're good. Let me just double check here. It's always the after show that continues live. That's hilarious.
No, I was just going to say, ours still says live on the side. So
the live, the recording of the meeting. But
fine, okay.
Let me see what's going on here. Oh, it is still live. Oops, sorry. People on let me turn it off. On Facebook and that, it's all right. Yalla, assalamu alaikum.